first thing to realize is that there's things that everybody wants, guaranteed access to care being the largest, right? Even if these bills get through and there's not a single mention of LGBT, if everyone in this country was covered, it would be a great impact for our community, right? We'd still have some degree of coverage. So guaranteed access to care, not involving individual mandates. An individual mandate means if you don't have health care and the government thinks that you have enough money to pay for it, you will be fined, right? It'll come out of your taxes. And what's really difficult about that is that you don't see low-income people sitting at those tables talking about what it means to be low income. So if we're talking about, let's say they decide that 10%, you should pay 10% of your income towards health care. If you're making $600,000 a year and you are a family of 4, $60,000 out of your budget isn't as big an impact than if you were a $30,000 family of 4 and you have to pay $3,000 a year, right? There's different impacts. That you're not giving up a country club membership at $30,000 to pay health care. We also want to make sure there's non-exclusion based on pre-existing conditions. If you've ever not had health insurance and gotten back on, you can be excluded for up to 6 months. So if you were, for example, someone who has asthma, a cancer survivor, if you actually have transgender coverage, we're trying to make sure that there's absolutely no exclusion. So the moment that you're covered for everything. The third one that really cuts across a lot of groups is mental health parity. LGBT individuals have a much higher rate of accessing mental health and substance abuse systems, not because LGBT people are somehow intrinsically mentally unhealthy, but as with all communities that suffer disproportionately from homophobia, biphobia, transphobia, racism, classism, ableism, it makes living more difficult, which means that you have more mental health stress, which means you're more likely, hopefully, to access the system. A couple of other things that we're looking at: addressing the HIV/AIDS epidemic, especially after 8 years of not being able to say the word gay, to actually have an HIV/AIDS epidemic that will be able to treat LGBT individuals as individuals instead of as vectors of disease. Providing inclusive reproductive health care. And by that I mean if a straight woman can access it, a lesbian should be able to access it too in the same way. Or again, with the infertility thing, having a separate test to determine lesbian infertility. Data collection, which I've already talked about. Data collection is one of those things that seems so intensely boring unless you're like a policy or a data geek like I am, right? And then you get really excited to talk about data collection. And to make sure that data collection includes both sexual orientation and gender identity and makes sense to LGBT people. And we've actually done a lot of testing around what kind of question you can ask and get an appropriate response. And what we found was, we asked the question, how do you identify? Check one or more, right? Because transgender people also have a sexual orientation. We shouldn't forget that. And it said, how do you identify? Check one or more. First box, heterosexual. Second box, gay or lesbian. Third box, bisexual. Fourth box, transgender. Fifth box, other. Please explain. And we found this huge percentage of people who were bisexual. And what we found after we went back and tested was that people who are heterosexual don't identify themselves as heterosexual. They don't think they have a sexual orientation, and if they do, it's straight. So we had all of these people checking the box bisexual because they thought, I'm a woman, I'm dating a man, there's 2 of us, bisexual. Right? And it was actually, we saw a huge skewing of people over the age of 65 who identified as bisexual, and we're like, does things get more interesting after time? But it turns out opposite sex, not bisexual. The other one that we're looking at is health information technology, another huge overlap with reproductive justice. As we move to nationalizing health information systems, sometimes it matters that you're transgender, sometimes it doesn't. Sometimes it matters that you had an abortion 6 months ago, sometimes it doesn't. We need to make sure that if someone goes into the emergency room and you can pull up their medical history, there are parts of that that remain private. Right? If you usually have a doctor who's a great doctor, you're completely out with them about all aspects of your sexual life, who your partners are. We don't necessarily want that doctor putting everything into your medical thing, because then you break your leg, have to go to the emergency room. Next thing you know, you have the whole, what we call the transgender broken leg syndrome, with you go in and they say, so you're transgender, let's talk about that. You're like, but I broke my leg, right? It has nothing to do with my genitals or my gender identity. I broke my leg, and that's what you need to focus on. we can make sure that health information technology protects our community. Another one, mandating the implementation and practice of cultural competency, or at least cultural awareness, that different people have different needs, so that we can go in and say, you know what, I've never been on birth control because I've never had sex with a man who could impregnate me, or to say I have a female partner now, to know how that makes our risks different and how it doesn't impact what our risks look like. And the last one I'm going to end up with is talking, whenever you write legislation around healthcare, you're going to put in some kind of definition of family or spouse or dependent. We need to make sure that our families can access care that way. And we're actually working, we're forming a coalition with the National Latina Institute for Reproductive Health and NAPOF, the National Asian Pacific American Women's Forum, to talk about how family definition impacts LGBT individuals and immigrant families at a much higher rate. So for LGBT people, let's say that I'm the biological parent of my child and I get health insurance through my child, right, because she's covered through a government program, so therefore I'm covered. Can my partner also be covered even if we're not legally recognized? Also keeping in mind that in the federal government, because of the Defense of Marriage Act, they can't legally recognize us, so what does that look like? And then for immigrant families, if I'm in this country legally and I have standing and my partner does not have papers, can he or she then be covered? And what does that look like? Also talking about how LGBT people, people of color, and immigrant families are much more likely to structure their families in extended family networks. So if grandma's taking care of baby, can both mother, grandmother, and baby all be covered? And then if baby goes to the hospital, can grandma access health records to say this is what needs to happen for the baby that I'm taking care of because the mother is working right now or out of the picture, whatever that looks like. That's what I'm going to end with. What I will say is that, again, this is happening really, really, really quickly. And if you're interested in getting kind of the LGBT angles on healthcare reform, we send out action alerts and people need to respond. We're having the whole, we're having ENDA, the Employment Non-Discrimination Act, is happening right now as well. So the LGBT movement is really, really busy with action alerts. But healthcare reform needs to stay as one of those. And I would also add that we're having probably our major problem that we're finding is that because of what happened with ENDA last year, where gender identity was pulled out of the bill, for the first time legislators realized that there was a difference between sexual orientation and gender identity. We're really struggling in places where sexual orientation is now being included to get gender identity also included in healthcare reform. So that's one of the big battles that